Have you been diagnosed with a knee meniscus tear and you are wondering what you should do about it? Or maybe you've already met with a surgeon and he said that the only way for you to get back to an active lifestyle was to have surgery, and you're wondering if that's actually true and you're looking for a second opinion. Well, then today's video is for you. I recently had somebody come into the clinic who had been told by a surgeon that the only way for this active young gentleman to get back to living an active lifestyle was for him to have surgery. Now, he brought me his MRI report. I was able to see the pictures of the MRI, and I gave him some different advice. So I'm going to offer that to you today, as well as give you some research that backs up what I say, and then also give you some ideas on what you need to be focused on if you have been diagnosed with a mini meniscus tear. So first, let's start off. How do you know if you've torn your meniscus? Well, usually you'll have pain either on the inside or the outside of your knee. So you actually have two meniscus in your knee. There's a medial meniscus and a lateral meniscus. The medial one's on the inside of your knee. The lateral one is on the outside of your knee. Now, they're a little bit different shaped, but they both have the same function, and that is that they are shock absorbers. So they help to take the shock from the floor up to your body, but also from your body down to the floor. And they help cushion everything. So they're kind of like these gel pads. So obviously they're pretty important because we don't want to have that knee joint unprotected. So when you get a tear in the meniscus, what most commonly happens is that it looks kind of like a fracture or a line through the meniscus. It may go all the way through. It can go all the way down to the bone. If it goes all the way down to the bone, that's actually better, but we'll get back to that in a second. Now, the thing is, there is one big difference that can happen that can change my entire outlook on this. And this is really important to hear this part. If there is a tear and part of the meniscus actually flaps up, now you've got a big problem, and I would recommend that you have surgery. The reason why, that flap will get stuck and cause locking in the joint, which means your knee will not be able to move normally. So even if you rehab it properly, you're still going to be at risk of not having normal knee motion. And what happens if you don't have normal motion? You're going to have problems in the long term. So if you have been diagnosed with a meniscus tear and there's a flap, which you would know because you would have a locking in the joint. You would try to either bend or straighten your leg and you'd be like, it doesn't go any further. Now, I'm not talking about swelling. Okay, when the joint is swollen, you can feel like, oh, it's really tight. I don't want to go any further. That's different than a tear with a flap, because that is, I literally cannot go any further. That's as far as it's going to go. The only way for a flap to be repaired is surgery. So in this video specifically, we're talking about meniscal tears that remain lying flat on the joint, that are not flapped up. I'm sorry, if you have a flap, I would recommend surgery because that's the only way to deal with a flap, and they're gonna have to cut it out. That's just, sorry, but that's just all there is to it. Now, assuming that you have a meniscal tear, but it's just lying flat, if you're still with me at this point, what happens is that the knee meniscus has a red zone and it has a black zone. The red zone is on the outside, and that is where there's blood flow. So if there's blood flow, there can be healing. Also, I said earlier, I was talking about if the tear goes all the way down to the bone, that's actually a good thing. Well, the reason why is because the bone also has blood flow. So if the tear is a full thickness tear and goes all the way down to the bone, well, that's actually a good thing because, hello, there's blood flow in the bone. So if it's in the red zone, that means it can actually heal. Your body is designed to be able to heal itself as long as it's given the proper movement, and menisci are just like every other tissue in your body, as long as it's in the red zone. Now, what happens if your tear is in the black zone? Well, this is a little bit more challenging. You won't necessarily have direct blood supply in that zone, which means it will be harder to heal. Can the body still heal that area? Yes, but it's going to put down scar tissue. which is not ideal because scar tissue causes a change in the movement of the joint. It's going to take longer to rehab, and you're going to have to be really, really focused with your rehab with that. So the black zone, not ideal. The red zone, fantastic, because there's blood flow, goes down to the bone. We actually like that because, again, there's blood flow, which means that there can be healing. Here's the thing to consider. If you have surgery, they are going to cut through tissue that has not been damaged. They're going to cut through the skin. They're going to cut through the subcutaneous fat. They're going to cut through the fascia. They're going to cut through the joint capsule, potentially some muscles, as they get into that joint to fix the meniscus. All of those tissues which are not currently injured have to be cut through in order to get to the meniscus. So you are inherently damaging other tissues in order to get to the meniscus. Now, again, if you have a flap, that's just something that you're gonna have to do because we've got to get rid of that flap and get that joint moving correctly. However, if you don't have a flap and it's lying flat and it's a tear that's in the red zone and it has the potential to heal itself on its own, why would you want to cut through perfectly healthy tissue and maybe cause some changes in that? Specifically the joint capsule. The joint capsule is one of those tissues that never seems to heal correctly, even after surgery. So I think of it like a balloon. So if you blow up a balloon and then you take a pin, so that's good, like they do surgery, right? So you take a pin and you apply it to the balloon, what's going to happen? It's going to pop. Now, can you put a patch, which is what scar tissue would be, can you put a patch on that balloon and then be able to blow it up again? Yes, but it's hard to get that patch to be applied correctly and to move like the rest of the balloon, right? It's always a patch, it's always scar tissue, it's always going to be a little bit different. Are there things that you can do about it if you've already had arthroscopic surgery or even more intense surgery on your knee? Yes, there are things that can be done afterwards to try to help remodel that scar tissue. My question is, why would you go ahead and have surgery that's going to cut through tissue that's not damaged in order to get to a tissue that has the potential to heal on its own? Now, the surgeon would say that you want to go in and fix this tissue so that it heals completely. But does it heal better after surgery than on its own? Can the body actually heal better potentially without surgery? This one's really difficult to say. And to be fair, there are no MRIs, because who's going to do an MRI after you've done surgery or when the pain goes away, right? Nobody. It doesn't make sense. We don't want to be exposed to that radiation and all of that. So nobody's going to do an MRI at that point, right? And I understand. And there's no research out there that indicates what actually happens to the meniscus if you have surgery versus if you don't. So we have to think a logical process here. If you have surgery and you stitch together the meniscus, then that's obviously going to create scar tissue in there. I mean, really, that's the whole point, right? Is to create scar tissue, which allows that lattice work to form so the meniscus can heal back together. And they do have dissolvable stitches, so eventually they'll kind of just go away on their own. Okay, that makes sense. But if the two parts of the meniscus are actually aligned together, can they not just grow together on their own? I mean, it stands to reason, right? Every tissue in our body is designed to be able to heal itself, and then you don't have to cut through the tissue that's not damaged. So again, that joint capsule in particular is the one that I'm concerned about, because you don't want to pop that balloon. It's just hard to deal with it afterwards. Now, the person I was talking to was pretty convinced by this argument. I'm hoping that you are too. However, he had a very valid question, and he said, is there any research that can actually prove this? Because my thing is not necessarily what's going to happen today, but what are your long-term outcomes? So if you have surgery, if you don't have surgery, where are you going to be in 1 year? Where are you going to be in 20 years? Because this was the thing. The surgeon was scaring him that he was going to have early onset arthritis if he didn't have surgery. And I was telling him, I am concerned that you're going to have early onset arthritis if you do have surgery, because you're cutting through the joint capsule and you're changing the biomechanics of the joint. So he wanted to know, well, where's the research, right? Who knows who's right? The research would tell us who's right. So I found a couple of research studies. Now you'll be surprised to find potentially that not a lot of these are performed in the United States, because in other countries, it's more agreeable to do research where you randomize people to surgery or not to surgery. In the United States, it's more difficult because people want, well, what they want. So if they want to have surgery, they don't want to be put in a study where they may not be able to get surgery. Or if they don't want surgery, they don't want to be put in a study where they do have to have surgery. So, we have pretty strong opinions about what we want around here. So one of the studies is from the Netherlands, and it's Zanetti et al. And what they were looking at was suspected meniscal tears. So they took 100 clients who had a suspected meniscal tear. So they had done testing. This is not MRI yet. They had done testing and they suspected that these 100 people had a meniscus tear. The gold standard to diagnose a meniscus tear is MRI, and so that's what they did. They did an MRI on the knee that had the suspected meniscal tear. They also, though, did an MRI on the other knee of this same person. So they put 100 people through MRIs on both knees, one that had a suspected meniscal tear, the other one that did not. What they found was 57 people with a suspected meniscal tear on that side did indeed have a meniscal tear. So again, MRI is the gold standard. Those 57 people had a meniscus tear. Now here's where it gets interesting. 36 of those people had a meniscus tear on the other side. That was asymptomatic, which means they did not have any symptoms. So they did not know about the meniscus tear on the other side. They only knew about it on the side that was symptomatic. Probably painful, decreased function, all of those things. What that means is 36 of 57 people had a meniscus tear that they did not even know about it because they did not have symptoms. Which is fascinating because, again, with the advent of MRIs, it's been great because we get to see what's actually going on inside of the body, and that's fantastic, except for sometimes we find out things that actually aren't the thing that's causing the problem. We see this a lot with low backs and surgeries and things like that. So yes, an MRI is the gold standard to diagnose if there's a meniscus tear, but just because there's a meniscus tear doesn't need to be fixed. So let's go to the next study. So Van de Graaff et al. Did a study where they randomly assigned 321 patients, obviously not performed in the United States, 321 patients to an arthroscopic partial meniscectomy. So they go in with the probes, they take out a little part of the meniscus, the part that's torn. So they're going to take out the little torn part, or just to physical therapy. Now, that's what I love about other countries, is that you can just randomly assign people and you can match them up and all of that good stuff. But 321 patients is a pretty good indication. That's a good size study. So it was performed over 2 years, and then they followed up with them right after they finished their rehab, because even the surgery people did rehab. And then 6 months later, as well as 2 years later. And here's where the fascinating part comes in. When they followed up with these 321 people 2 years after they had surgery, there was literally no difference in function between the people who had surgery and the people who just did the rehab. That means that 160 people had surgery and had the same functional outcomes as the 160 people who didn't go through the surgery. They were able to do the same things. Now, function was based on what they wanted to do in life. So they gave them a test and it based on what they wanted to do. So I'm not saying that everybody got back to running, because they all had different functional goals that they were looking for. They were self-rating themselves on their function prior to this injury and then where they were at this time. No difference in outcomes between surgical candidates and non-surgical candidates, ones who just did physical therapy. What this means for you is that you do not have to have surgery if your meniscus is in the correct position and not flapping up. It does mean that you need to do physical therapy. It is critically important to get this joint moving correctly to help nourish the meniscus and help it to be able to heal, to avoid compression on the meniscus while it's healing, and to have a proper rehabilitation program. And most people don't know how to do this on their own. You need to be guided and you need some help. If you don't, it's going to cause problems in the long term, because what happens is people get a meniscus tear, whether or not they have surgery, they don't do rehab. And if you do surgery, you still need rehab, friends. You need rehab after surgery. I'm not going to listen to the surgeon on this one. You need to rehab that knee. Either way, surgery, get some rehab. Because if you don't rehab that knee properly, what's going to happen is you're not going to have normal biomechanics. Your joint is going to be loose or stiff or not move correctly, and that's what leads to the early onset osteoarthritis. That's when you see people in their 30s who are already exhibiting signs of knee osteoarthritis. They change their gait pattern, they change how they're functioning in life, they change their balance capabilities, they start weight bearing more on the other side, which throws off the other side, which can throw off the hips and the low back. Friends, I see it all the time. It starts with a simple injury and then it progresses to something that becomes so much more. And they show up in my clinic 10 to 20 years later, and if they had surgery or if they didn't have surgery at that point, it doesn't matter. They've got early onset arthritis, they've got low back pain because they've been functioning with abnormal biomechanics for way too long. And it becomes quite the sticky mess to undo. Now, we can undo it. There is hope for you. If this is your story and you say, yes, I did have the surgery 15 years ago, and no, I did not have rehab at the time because my surgeon told me I didn't need it, but yes, I am having hip, low back, SI joint pain now, there is still hope for you. We still can undo that sticky mess. It's just going to take a while because it's been going on for 15 years. So I hope that that has been helpful. I hope if you have a meniscus tear and you are considering surgery that you will reconsider it. I hope that you will find a very good manually trained physical therapist who can help walk you through a rehab process and get you back to all the things that you love doing. Now to you, what questions do you have? What decision did you make about your knee meniscus and what needed to be done? Did you choose surgery? Are you glad you did? Drop a comment below. We'd love to hear your input. We'd love for you to hit the subscribe button and check out this video over here. Have a great day, everyone. Bye.